This was not a smart policy to rush reopening. It did not help the economy. It's the exact opposite. The volatility, the instability, the concern about the path of this nation has roiled the markets. And at the same time, from a public health point of view, the number of deaths is increasing. IHME, the model that the White House follows, just increased by 10,000 their death prediction, number of people who will die. Why? Because they're extrapolating out from the increase in infections and the increase in hospitalizations. The White House has been saying, well, it's up to the states. It's up to the states. But the president didn't really leave it up to the states. The president has been pressuring states to reopen quickly. Liberate your state, liberate New York, demonstrations that I've been dealing with all across the state, pressuring governors to reopen. The denial by the federal government of the severity of this virus was followed by the federal government's abandonment of responsibility. If you don't believe it's a problem, you don't try to find a solution. And that's what happened with the federal government and coronavirus. They never believed it was a problem, so they didn't believe they needed to solve it. The key barometer in all of this has been testing. Everybody said that from day one. Every federal official, every state official. Get the testing up. Get the testing ready. How many testing sites across America has the federal government set up and operated? 41. Well, is that a lot or a little? Well, for comparison, you know how many sites we have in the state of New York? 750. Federal government has put up 41 sites, FEMA and HHS, that they operate. How can that be? Because from day one, they told you they didn't believe it was a problem. They started day one, it's like the flu. If it's not a problem, you don't try to solve it. And they didn't try to solve it. And as a matter of fact, they have been advocating from day one, reopen the economy, reopen the economy. And now we see the results. It just plain hasn't worked, and it has been a failure. Will Rogers, when you find yourself in a hole, stop digging. Not a New York quote, but it's right. Where are we in New York? We've been smart. We didn't do this politically. We followed the facts. We followed the data, and it works. We have the lowest level of hospitalizations since this nightmare began, 853. Amen. We have the lowest three-day average death total. We're down to 8 deaths yesterday. We remember the 8 in our thoughts and prayers, and we don't want to lose anyone in this state. But you look at where we are compared to where we have been. You remember at one time we had 800 deaths per day. Today we have 8. We do more testing than any state in the United States. We did 46,000 tests yesterday on a Sunday, and the infection rate was 0.8. When you're below 0.1, that's our goal. And 0.8 is lower than it was some points last week. You look at all the different regions, the numbers have been good all across the regions that are opening, going through phased reopenings. The numbers are all constant. You look at New York City. Within New York City, we study the boroughs because there's a wide variance in the infection rate. It tends to be worse in the outer boroughs, but you can follow that day by day, and that's good. We have a very elaborate tracing system so that when we find a positive case, we trace it back. That has been working very well because we have found traced back to clusters of cases. Westchester County graduation, where there was a young man who apparently came up from Florida and attended a graduation that generated 13 cases. There's an aluminum factory in Montgomery, 500 employees, 74 positives. Washington County, a slate quarry, 12 cases that we traced back. Oswego Apple Factory, 82 cases. This is actually good news. It means the system works. You find the positive, you trace it back, you find the common denominator, and that's how you stop the spread. You look at our curve compared to the rest of the country, you see the rest of the country is going up and we're going down. As we continue to test, we continue to trace, we have the data, we're continuing on our reopening plan. Phase 4 is ready for Western New York tomorrow, so we're excited about that. In New York City, we have complications that we are studying now. New York City is currently in phase 2. Phase 3 would begin on Monday. But there are issues that we have to think through. One is there's a lack of compliance with social distancing in New York City. You can see it in pictures. You can see it if you walk down the street. You can see the crowds in front of bars. You can see the crowds on street corners. It is undeniable. That is partially the responsibility of citizens not to do it. It's also the responsibility of the local governments to enforce compliance. We ask everyone to comply, but we ask the local governments to enforce the compliance. And I've said from the very outset of this to all the county executives, all the mayors across the state, look, the state is more than doing its part. The responsibility for the local governments, help with testing, help with tracing, but do the local compliance of the socially distanced and mask wearing. That is a complication in New York City. The other complication is the spread across the nation is also problematic for us. We are not a separate country, New York. Some people think we are, but we're really not. And we're not an island, right? People from the other states travel to New York, and New York is a hub. If other states have a high infection rate, probability is they're going to wind up increasing the spread and the infection in New York. We learned that the hard way. Why did New York have that big spike when we started? Why was New York so different from every other state? Because the virus came from Europe. When the federal government was telling us the virus was in China, it had left China, it went to Europe. We had 3 million people come in from flights from Europe, January, February, March. That's where the virus came from in New York. Likewise, we're bringing the rate down. Other states, it's going up. People get on planes in the other states, fly through New York, fly to New York. Probability is they're going to bring the infection. One of the issues we're working on in New York City, indoor dining has shown that it has been problematic, that a virus spreads in closed indoor areas that have air-conditioned systems. So we know that indoor dining has been problematic. Outdoor dining has worked very well all across the state, New York City included. The state's going to be reviewing the data and consulting with stakeholders in New York City. I've started speaking with restaurant owners, business owners about the risk-reward on indoor dining. We've been speaking with Controller Scott Stringer, who raises a lot of good points about the risk of indoor dining. The Speaker, Corey Johnson, the same thing. The mayor, the same thing. So I'm talking to business owners about it. We're going through the data, but this is a real issue. Our reopenings have worked very well. We're not going backwards, we're going forwards. A lot of these other states actually have had to go backwards. They started to reopen and they had to stop. But we want to study this issue primarily New York City on indoor dining. And we'll have a final decision by Wednesday. So people who operate those types of businesses